Good evening, and welcome to this very important webinar we have planned for you tonight. I want to start by saying thank you to our partners at the National Black Nurses Association, President Dr. Martha Dawson and Executive Director Dr. Millicent Gorham for bringing us this really important discussion that we have brought to you tonight. So we're going to be talking about keeping children safe during spring break. And so what does that mean? That means that, yes, the pandemic is still on. And I know things are opening up, mandates are relaxing, people are getting back out. And that is all great. That's all well fine and good. But the pandemic is still going on. We still have to have over 900,000 deaths, and people are still being infected and hospitalized. Not at the same rate, but they still are. And so we have to still take those precautions to keep our home safe. So how do we do that? And how do we keep our children safe? Well, that's what we're here to discuss tonight. So we have two wonderful guests with you this evening. We have Dr. Tim Molinex. He is the Vaccine Medical Director at Pfizer Global Vaccines. And then we also have welcoming back Dr. Helena Brown, who is the Child Health Medical Director and Laboratory Director at Jefferson County Department of Health in Jefferson County, Alabama. So we're going to start with Dr. Molinex, and he's going to come on and give us the latest on where we are with the vaccines and COVID and all of these things. So welcome, Dr. Molinex. Very excited to see what you're going to share with us this evening.
Appreciate it. Thanks for the invitation. Let me make sure this works. Worked once before. Sharing. All right, just let me know if you can see the slides.
There you are.
All right, perfect. Okay, let me hide this. So thanks, everyone, and I appreciate the opportunity to talk with you this evening. I appreciate you taking time out of your busy day. You've all worked hard today, and we appreciate all that you're doing to help vaccinate children and adults everywhere. So thank you for all you do for helping people get through these major decisions about vaccinations and how important they are. So I really appreciate it. So what I want to do tonight in a limited time is update you on our Pfizer-BioNTech COVID-19 vaccine, otherwise known as Comirnaty, particularly as it relates to pediatric and our adolescent vaccine. There's been a number of changes and some recent submissions. So I just want to briefly update you on kind of where we're at and what's happening around the vaccine. So first of all, I just want to point out that we have two situations. We have a vaccine that is licensed and approved by the FDA called Comirnaty. It is a licensed and approved for 16 years of age and older in a two-dose regimen. And we also have our vaccine that is under emergency use authorization. And this slide describes that. Now, because there's two names here, there's a Comirnaty and there's a Pfizer-BioNTech COVID-19 vaccine. There's some confusion about whether it's the same vaccine or not. It is the same vaccine and can be used interchangeably. And what I mean by that is the 12 and above age, which is either a purple top or a gray top, we'll talk about in a minute, can be used interchangeably. They are similar vaccines and can be used that without any safety or effectiveness concerns. Now, for ages 5 through 11, that's a different vaccine. It's same formulation. It's just in a different dose and concentration. So it's important to distinguish those two, and we'll talk about that. So again, we have approval for 16 years of age and older, and we have emergency use authorization for 5 through 11 and 12 through 16. So again, as I mentioned before, we have 3 presentations. For 12 years and above, there's the original purple top, which most people are familiar with. The purple top is being phased out. The gray cap is now being distributed and replacing the purple cap. And there's a lot of advantages to the gray cap, which I'll talk about in a minute. We also have the orange cap. The orange cap is available then for those 5 through 11. It's a different dose. So it's important to be able to distinguish these two doses, and they're not interchangeable. And I'll talk about that in just a minute. So there are 2 versions of fact sheets. I refer everyone to the emergency use authorization fact sheets for recipients as well as caregivers for the various dosing ages. So let me just spend a couple minutes in distinguishing between. Now, we talked about a different formulation. So purple cap was the original. And what we did is we changed the buffering system for the gray and orange, which allows us greater storage ability. So we've greatly improved the ability to store the vaccine with the newer versions of the vaccine. So the gray cap, I want to make a point, is again for 12 and above, it will be replacing the purple cap. And again, there's no dilution for the gray cap. The gray cap is ready to use. And it's a 30 mic dose, 0.3 mLs, nice, small injection. And that's an advantage, particularly for adolescents and kids.
Those of us that have had it want to say thank you for that small dose. For the record.
Yes, and so for the orange cap, it's even smaller. So it's a 10 mic and it's a 0.2 ml, which for most of us, that you can hardly feel that going in. So it's a big advantage from that standpoint. Now, I just want to make a couple points here that the big changes for the gray and orange cap is that you can store these in a refrigerator for 10 weeks. 10 weeks. And the ultra cold storage is now up to 9 months. So we've really expanded that. Another big factor is at room temperature. Once it's been thawed or reconstituted, it's now able to sit there for 12 hours at that point. So again, you're not running around with that 2 hour or 6 hour problem we had with the purple cap. So a lot of improvement in our ability to store and administer these vaccines. So now I just want to give you a quick update as it relates to, again, the pediatric. As you may be aware, on February 1st, at the request of the FDA, Pfizer and BioNTech initiated a submission of our available data on the safety and efficacy of 2 3 microgram doses. And this was part of a 3-dose primary series for children 6 months of age through 4 years of age, really trying to address an urgent public health need at that point in time. Now, on February 11th, as the cases continue to accrue according to the study protocol, we announced plans to amend the emergency use authorization of the Pfizer vaccine for children 6 months to 4 years. And we wanted to wait until all the data came in for the 3-dose data, which we expect to happen in early April. Now, what I want to point out is that our independent data monitoring committee for the study supports the continuation of the trial and believe that the data collected to date indicate that the vaccine is well tolerated and supports a potential 3-dose regimen in this age group. Now, you'll hear continuing updates about this as it relates, and this will be the potential maroon cap or the extra new color for this coming out soon.
So our crayon box is expanding in terms of colors and cap colors. But,
yes. Yeah.
Okay.
Now, one thing I want to point out, because we've gotten a lot of questions and I've gotten a lot of responses from some pediatricians that are very anxious to vaccinate the children. And the question was, can I use a current formulation to vaccinate kids 6 months to 4 years? And the answer is absolutely no, for 2 reasons. One, it's not approved. We don't have FDA or emergency use authorization for this, and we're getting ready to submit for that. And secondly, the doses are very different, and it's very difficult to get the dose that's going to be required for that 6 month through 4 year dose. So again, the purple gray cap is authorized for 12 and above. The orange cap is for 5 through 11. And again, as emergency use authorization is received, then we'll be able to introduce, again, a maroon cap new vaccine with easy dosing for that group. So I just want to point that out. So again, what we're seeing now, however, the most frequent reported non-serious adverse events to VAERS following the Pfizer vaccination kids 5 to 11 is preparation mistakes or issues, the incorrect dose, and underdosing. So people are having difficulty with the orange cap and getting the right administration. So again, it's critical that they receive the correct dose from the correct formulation, and that's the orange cap for 5 to 11. Again, purple cap and gray cap are not authorized for 5 to 11, so don't be trying to get a dose out of there to match the orange cap. The orange cap is authorized for the 10 mic dose. It's a third of the adult dose. And again, that 10 microgram dose is for 5 through 11.
So if so, I'm sorry to interrupt, but so if my math is correct, we're looking at about 44% of the reporting to VAERS system is due to some sort of kind of either dosage error and it's not due to a side effect to that the child is having with the medication. So we're like almost half is just due to dosage error.
Well, according to those numbers, and the thing I want to point out is VAERS is not just about adverse events or side effects. It's also about administration errors, and
Right.
and we're seeing a lot of those at this point in time. So again, recognize your age, recognize the appropriate vaccine, and recognize the 0.2 mLs for, again, those 5 through 11, and the 0.3 mLs for 12 and above.
Gotcha.
So just to walk through these schedules now, because they are different. And so for the 5 through 11, the approved primary series is 2 doses of 0.2 mLs, 3 weeks apart. All right. Now, there's an additional dose approved for immunocompromised individuals, 5 through 11, that you can administer 28 days later. Again, for immunocompromised kids, 5 through 11. But for most kids, 5 through 11, right now, it's 2 doses, 3 weeks apart, 0.2 mLs. So one of the questions we get all the time, and I still get this question, is what do you do with a kid that's changing from 11 years to 12 years of age? So 11-year-old is going to get his first dose, and then by the time he gets his second dose, he's going to be 12. So there are 2 answers to this, and I just want to make sure that everybody understands this. So according to the FDA states that, again, an individual who will turn 11 to 12 between their first and second dose can get either an orange cap dose or a gray purple cap dose. So what that means is at 11, you can get the 10 mic dose. At 12, you can get the 30 mic dose. Or you can get a 10 mic dose at 11 and you can get a 10 mic dose at 12. Or you can get a purple cap, gray cap at 11 and a purple gray cap at that. So the FDA allows flexibility around the recommendation overall. And you're not wrong for any of those choices.
Well, that's the question I'm gonna ask Dr. Brown. I'm like, I'm just curious as a parent. I'm like, just wait till they turn 12
Good question.
and skip all that confusion. But we're gonna make sure I will talk to a pediatrician about that because that would require waiting almost up to 3 weeks to get the child vaccinated.
So the CDC, however, they made a different recommendations, and their guidelines state that they should receive the dose based on their age. So if they're 11, they should get the 10 mic orange cap, and when they turn 12, they should get the purple gray cap 30 mic dose. So that's the CDC recommendation. So either one of those is okay. I just want to let you know that there is some confusion, but you can't go wrong either way from the FDA or from the CDC. So let's talk about the adolescents, the 12 and older. And again, this is where we get into different schedules because now the primary series, as you know, is 2 doses. But now for immunocompromised, there's a 3rd dose at 28 days and beyond. And recently now there's a booster recommended. So if you're not immunocompromised, you get your regular 2 doses. And then at least 5 months later, a booster is recommended for, again, this would be the gray or purple cap in those 12 years of age and older. So again, the primary series interval, Pfizer-BioNTech for ages 5 and older as a 2 primary series, okay? And those, again, a 3rd primary series for those 5 who are immunocompromised only. So this is what the CDC recommends. Again, considerations. They made a recent change to this. So for 12 years of age and older, they've extended the interval between the first and second dose to 8 weeks.
Okay.
So in 12 and above, you can give a second dose from 3 to 8 weeks out. And the reason why they did this is because although the absolute risk is small, the relative risk of myocarditis is higher in males aged 12 to 39 years of age. And what's thought is that by extending that interval, we may be able to reduce that risk of myocarditis. So they've authorized the interval between the first and second doses to be extended out to 8 weeks to potentially reduce the risk of myocarditis in that age group, particularly in males.
And just for audience edification, myocarditis is an inflammation of the heart. There's an inflammation of the heart. However, I will also point out that it happens more naturally than it does from the vaccine. The rates are happening more of myocarditis are happening it's just naturally occurring than from the vaccine. And most of the vaccine cases have cleared up on their own without having had any medical intervention. So I just want to say, give you the definition of myocarditis, and this kind of gives you the understanding of the implications as it comes to the vaccine.
That's a great point. And what we know is that the vaccine-induced myocarditis is self-limiting, short course, but the myocarditis associated with getting the infection is much higher than that from the vaccine. So you actually have a greater risk of getting myocarditis from getting infected from COVID-19 than you do from receiving the vaccine. And overall. Now, there are some situations where that extension is not recommended. It's not recommended in those who are immunocompromised. It's not recommended in 65 and older. And again, it's not recommended in people who need instant protection, who may be in an environment where there's a lot of disease overall. So again, we don't know if there's any benefit. There's no data for that, but the CDC has made this recommendation, and we will wait and see. So the other one then is, again, people with moderate to severe immunocompromise. We talked about the 5 and older. That is, they get that third dose. Again, the same thing with 12 and older, you get a third dose. But for the 12 and older, you get a boost. So again, for ages 12 and older, it's actually 4 total doses. And that's the difference between the 5 to 11, is that there's 3 doses right now. And for the 12 and above, it would be considered 4 doses as complete therapy for someone who is immunocompromised. So just make sure you're aware of those guidelines. So just to briefly talk about other vaccines, there's no information from us about co-administration. However, the CDC does say that the COVID-19 vaccines may be administered without regard to timing to other vaccines. This includes simultaneous administration, all right, of other vaccines on the same day. Always remember, if you're giving multiple vaccines, please administer at different sites. But the CDC says that you can administer other vaccines at the same time if they are needed and necessary. Now, I just want to finish up talking a little bit about some safety, other considerations I just want to remind everybody of. Again, please be aware of the potential for severe allergic reactions to any component. And if you are administering the vaccines, you need to have appropriate medical therapy available in the case of an immediate allergic reaction. Again, all these need to be monitored and identified and reported to the CDC. Again, post-marketing data has shown an increased risk of myocarditis in individuals within 7 days, and particularly in males in that 12 to really 39 years of age, but it seems to be self-limiting and goes away, and the overall risk is very small. Syncope may occur, so people getting shots don't like shots, so just make sure everybody's aware of that. The nice thing is for the COVID-19 Pfizer vaccine, it's a very, very small amount. Again, immunocompromised people may have a diminished immune response. That's why we're giving multiple doses. And again, the vaccine may not protect all individuals overall. Now, I just want to briefly talk about the adverse reactions. Again, the most common ones were pain at the injection site, fatigue, headache, muscle pain, chills, joint pain. And these are consistent through all the age groups. In fact, the younger individuals were much more tolerant than the older individuals. We had higher rates overall, so they were much more tolerant of the adverse events overall. And lastly, I just want to finish about making you aware of the CDC interim clinical considerations for vaccine use. I highly recommend you go to this website at cdc.gov. You can search clinical considerations COVID-19 vaccines because they always provide updated information about different groups, about who should get a booster, about co-administration with other vaccines. Again, vaccine for children, adolescents, which we talked about tonight, pregnancy, lactation, fertility, all those questions that have come up. The information is there in support of vaccination. And I think the most complicated part is guidance for people who are immunocompromised. So again, I highly recommend that you visit this site and keep it handy and visit it often for updated information. So with that, my 20 minutes are up. I'm going to stop and turn it back to you.
Excellent, excellent, excellent. So we're going to
If
bring
I
in
can
Dr. Brown
figure
here.
out how to get it back to you.
I got it. So we're going to, and if you're just joining us, I'm doing a quick reset. If you're just joining us, we are talking to Dr. Tim Mullenix, who just did a wonderful presentation on the vaccines. He worked for Pfizer, and he kind of broke down the difference in terms of the cap coloring and dosage amounts and where we are with regards to the vaccine. And we also now have we welcoming in Dr. Kalila Brown, who's a pediatrician and works in the state of Alabama. I'm not going to do the full title again, but we're going to now talk about the implications. So Dr. Mullenix did this wonderful presentation. So we're going to talk about, we have a couple of questions, and I'm going to fire to you first before we start talking about how do we keep our children safe. Marcia, out of your home state of Alabama, she asked, would we consider pediatric patients with multiple sclerosis immunocompromised?
So yes, anybody who's taking medications that would suppress their immune system. So if you're taking a steroid for multiple sclerosis, that would then make you someone who's immunocompromised. So you should definitely be talking to your specialist and finding out what group you fall into, as Dr. Mullenix talked about, and then getting your vaccine appropriate to that.
And I guess the second question from her is that can you give Mavriclad for multiple sclerosis with the COVID immunization?
So there's no contraindication there, but again, every child, every patient is different. So you need your provider to speak directly to your case to find out if that's the best medication for you.
So again, I think ultimately what we need to do is help parents kind of draw that line of demarcation between what if their child is immunocompromised or if they're not. So how do we help parents understand what that difference is?
So I think the best thing you can do is talk to your provider. Go in and say, these are the medications we're on. This is very confusing. Dr. Mullenix did a great job of kind of laying it out, but saying, where does my child fall? What do we need to be doing to make sure that we're getting them the appropriate vaccines at the appropriate interval and keeping them safe? That's around vaccines. That's around masking, your social distancing, how much risk you're willing to take. You need to compare that to what your child's medical considerations are, and not just your child, what's in your household. Do you have an older individual in your household? Do you have a parent who's immunocompromised or receiving cancer treatment? We've got to take all of that into consideration. So talking that over with your primary care provider is very important.
Absolutely. So like your child may have asthma, depending on the medication that you're taking, there could be some contraindications there. So again, this is a situation where you really have to work with your child's primary care physician, the provider, in order to be able to make that decision on what type of dosage, when that dosage, if you decided to get them vaccinated. Speaking of vaccines, so Dr. Brown, last time you were here, we really kind of talked about all the vaccines that our children get from birth to 15. Like we went all the way through. There's a number. I think you said there were like 15 or 16 different vaccines that we get over that span of time. I guess my question is, and this kind of sparked during Dr. Molnix's presentation, is if we can get that point, because I know right now they're still waiting on infants to age 4 or 5 vaccinated. If we can get the younger the patients vaccinated, do you think that will help kind of, I don't want to say end COVID, because I think it's always going to be there. But I think the younger that we are, like much like other vaccines, the younger that we get them introduced to those vaccines, the less opportunity it has for these viruses to impact our population to a great extent. Are you understanding what I'm
I do
asking?
understand. So, what we have to understand is that children 18 and under are 22% of our population in the United States. And currently, they're making up about 19% of COVID cases. And since September, we've had 7.7 million children diagnosed with COVID in our country since September. And so, understanding that children play a major role in the spread of this virus, even though it may be mild in that particular child. What is the exposure to the teacher or the administrator in their school? What is the exposure to the grandparents? Do they play with a child next door or one of their friends that's immunocompromised or receiving cancer treatment? All of those factors play in. So our children are vital to us getting to a point in this pandemic where we get to more of an endemic stage. And we also have to look at it from an individual standpoint. It's very important that we're doing everything that we can to protect our children so that they can go to school safely and do their activities safely. And we don't have to continue to have this kind of overshadowing that we've had over the last 2 years. We can get back to what children would think of as a normal life, and we can do that through vaccination.
Okay, so help us that sat in the back of the classroom that really weren't paying attention to science class. Um, Endemic, what does that mean?
So that means that we have that COVID is not gone, but it's not at a pandemic level, meaning it's not affecting us on a day-to-day basis. We have a low-lying level of COVID transmission, but it is at a point that we can handle it, if that makes sense. So with all of the things that we have now, we have vaccines, we now have treatments that you can get in the hospital, we have treatments that you can get outside of the hospital. Those are all the things that come along to treat COVID. So we can get there, but we've got to stop the spread. So that comes along with vaccines.
Right. Okay. All right. So for those of y'all that needed to know that, so almost like the way that the flu is now, I think the flu is still kind of endemic. It still happens. There's still a number of people that die. And I think the last number I saw was like 30 or 50,000 people die from the flu every year. So it's still around, but it's not. It's controllable because there's a number of ways to kind of treat, and there's a vaccine each year that you can get to help prevent you getting the flu. Is that hopefully the place where we want to get with COVID?
So flu is seasonal. So it's a little bit different. But you can think of things that we vaccinate against, like chickenpox. It's very rare that we see it, but we have not eradicated chickenpox from our population. We will see it. And so we want to get to that place with COVID that we may have some COVID transmission and we still have COVID cases, but it's not to a pandemic level where our hospitals are overrun and we're having overwhelming deaths. We want to get to a point where we can really manage it within our society if we cannot completely eradicate.
All right, so now let's get to the social stuff. Right? Okay, so it's March. Spring breaks are happening. Some school on spring break right now. I know my child's his spring break was last week, and there's a bunch more coming in the first week of April. And people like to, especially when it starts to get warmer, people like to travel. And this is the first spring break in that I can think of in the past 2 years where there hasn't been as many mandates. People are feeling a little bit more comfortable going out. Uh, Places are opening up more, allowing more people in. What can parents do to keep their children safe? Because we haven't reached that endemic stage yet. We're still in the pandemic stage. However, many people are acting as if we are beyond, we're not even endemic, we are no demic with regards to COVID, and they're just out there having fun. How do parents keep their children safe?
So I think it's important for us to recognize that our rates have gone down tremendously over the last several weeks within the United States, and they continue to go down. But like you said, we are not out of the woods yet. So I don't want people to get complacent. So the most important thing you can do for your child, again, is vaccinate. If they're not vaccinated, get them vaccinated. We still have 8.3 million 12 to 17-year-olds in the United States not vaccinated. Now is the time, when we've got low levels of transmission of COVID right now. Now is the time to get your vaccine so that you can feel safe going on vacation during spring break. I think it's also important for parents to know what the level of transmission is in the area that they're going. And so choose wisely where you're going. You want somewhere with low level risk, medium to low level risk, per the CDC, you can go to if you're vaccinated. You can be indoors without a mask. You can enjoy your vacation if you're relatively healthy and vaccinated and boosted.
Yeah, I will say, just from a personal standpoint, I went to Arizona recently, and before I left for my trip, I Googled what are the mandates in Arizona and what are the rates. And so it was a very quick search. So I just wanted to see where Arizona was versus where I live in Georgia, just to kind of get an understanding of what's happening before I got there. Um, and it made me feel a little bit better when I saw the overall numbers and what's going on. But I definitely encourage parents to do that. So, end of the school year is coming. You just said there's still a number of children that aren't vaccinated. And then you got summertime where they're going to be mixing it in camps where we know, at summer, yes, you spend a lot of time outside. The numbers have gone down the past 2 summers. The 2020 numbers went down, and we all acted crazy when the fall happened. And in 2021, same thing happened. Numbers went down, and then fall happened. We all, So, what do we do to prevent? How do we get parents to convince parents, hey, when your children are off from school, when you don't have to worry about, some schools are still having masks, some schools are mask optional. You don't have that kind of cloud hanging over them. How do we convince them that this is the prime opportunity to go get your kids vaccinated so they can prepare and be ready for the next school?
So I'll tell you, recently, I saw this striking graphic. I have a ninth grader, and based on when the pandemic started, her last normal year of school was sixth grade. And so understanding that if we want our children to get back to what we would consider normal school without the mask, the best thing we can do is get them vaccinated. We have time to get there. It's March. School, we'll get out in May. Our levels are relatively low. We've got the summer. Let's get out. Let's get vaccinated so that our children can, have a normal school year. But it was striking to me to think that I now have a high schooler that's not had a normal school year since their first year of middle school.
Yeah, you're right. It very much has become normalized, as part of their behavior, and children adapt much better than we have as adults. I was just kind of say that because like my son is he's like your daughter. He's in the ninth grade, and I do remember distinctly we were on spring break vacation, and a friend of mine that ran a hospital said, "Yeah, things are about to shut down." That was March of 2020. He said, "Yeah, this is bad," right? Because he was already seeing, he was on the front lines in the hospital and seeing people come in, and he was looking at the numbers and he said it wasn't good. And sure enough, we got that, and school shut down, and we went to homeschool. and now it's just common practice for him to put on a mask when I'm dropping him off to school. And so that's the challenge. But how do we get? Now that brings another question, right? How do we can recover physically, right? With vaccines, washing our hands, watching our distance. If we can get more people vaccinated, more children vaccinated, we know they're safe. But how do we recover mentally from 2.5 years, from not being able to experience life in school the way we normally would in, almost 3 years? How do we get our children back to that mental state?
Yeah, I think that's gonna take all of us, parents, teachers, mental health counselors. We're really gonna have to do the work, talking to our children, finding out where they are. Schools are doing a great job in assessing our children and seeing how much delay they've had. We've definitely seen test scores go down, reading proficiency go down. So putting in those programs that will help them get back to where we would like for them to be on grade level or above. It's going to take all of us within the community to do that. But the most important thing is getting out of this pandemic so that they stop having the worry of, the stress of losing a parent or a sick parent, losing household income because a parent is sick or hospitalized. Those are stressors that they take everywhere they go. So even when they leave the home, they take that stress with them to school, where it's very difficult for them to, pay attention and do the things that they need to do. So we've got to understand that it's not just about what's going on with the child. It's everything that they're having to deal with within the home. And so that's why it's so important to make sure that everybody's vaccinated, so that we aren't having hospitalizations and loss of income. And, unfortunately, sometimes loss of life.
So I've got a good question from one of the viewers, and they're asking, can children take the COVID antiviral kit? So they know they're out there. Can children take them?
Yes, so there are some approved for children 12 and above, if they are at high risk for severe COVID disease. And that would be decided upon by your provider. So if you have a child with significant medical diseases on medications that you are concerned about, if they test positive for COVID, typically your provider will speak with you. If you're doing a home test, and I think people forget about those home tests, but if you're doing a home test and your child is positive, go ahead and give your pediatrician or your family practitioner a call, so that they can evaluate your symptoms and figure out what will be the best plan for you.
Okay, we got another great question. Dr. Mona, you might want to chime in on this one. This says the Pfizer CEO said we might need a second booster. Will children also need that second booster?
So that's a great question, and I can state that we have, you probably saw the news, we have submitted as of March 15th data and information relating to, again, 12 and above, a potential for a second booster. This data came out of Israel, where Israel has been monitoring patients for a longer period of time. They're kind of ahead of us in the timeline of COVID, and we watched them very closely, and we've seen that the immunity has dropped off, and it looks like that a fourth dose, based upon the data from there and some data from the U.S., that a fourth dose would be necessary. Now that's going to be for, again, right now, 65 and above. So our data we've submitted for is for 65 and above at this point in time, just because, as you know, as you get older, we don't mount as good an immune response. And we have a term called immunosenescence, where our immune system just doesn't respond as well as someone 50 years of age. And it takes more doses to maintain that immune response. So yes, it's for 65 and above for a fourth dose at this point in time, and we've submitted to the FDA, and will be a review committee established soon to transparently evaluate this data.
Well, I would just say, thank you for that. That's good information to know. I would just say personally, yeah, I'm not bothered. I mean, by the time you've had the, 2 shots on the booster, it should be, you should be okay. Get the fourth one, and while that might feel, some kind of way, I think that peace of mind is worth it. Plus the protection, until we can get a handle on getting, till we get to that endemic state that Dr. Brown is alluding to. So I think, so Dr. Brown, children, right? Um, should are we working on a state where we can start just including the COVID vaccine in that kind of regimen of vaccines that we talked about previously? Is it something that we can add with our MMR and our tetanus and all these other shots that we have to take as a child? Can we just put COVID on that list and keep it moving?
So we're not quite there yet, just because COVID vaccines for our children are still under emergency use authorization. And so until they get full FDA approval, we're not at that stage yet. Do I think we will likely get to that point? I do. I think, just the same way we recommend a yearly flu shot. If we see COVID go to endemic levels, we will need to do that for our children to make sure that they continue to be safe in schools and doing their routine activities.
I think the challenge that we have with COVID is that um, misinformation. We know that that's the biggest thing, right, about the vaccines, and then this lack of understanding about there is too much of an equating it to the flu, right? And we know if we get the flu, most of us get sick a little bit. We get a fever. We're down for a couple of days. We bounce back, and there's no lingering effects if we clear the flu. With COVID, it's not quite the same, and so help parents understand that what can happen to their child if they do catch COVID, and even if they survive, which we know most people are surviving because the rates are what it is. But what could potentially be the lingering effects on their children after survival from the virus?
So yes, don't get me wrong. Flu is one of those diseases that we definitely want to protect against as well, but COVID is not flu. Flu is seasonal. We can pretty much tell you when you're going to see an uptick in flu. And if you look at the last 2 years where our children have been masked in school, our flu rates have plummeted. We've seen very few cases of flu, where that has not been the case with COVID. We are continuing to see COVID spread. When you look at Omicron and the severe uptick in cases of pediatric cases of COVID, total, I think there's been a little over 12.8 million cases of COVID throughout the pandemic in children. Again, like I said, with Omicron since September, 7.7 of those came September and after. So understanding that it's not the same, it's highly contagious. And then understanding that there's data out there that's showing it's increasing your child's risk for diabetes. There's some new research out that's talking about some issues with your gray matter in your brain and actually shrinkage of your brain. There's also data out there that we've been following with long COVID. And that one for me is really one that I'm interested in, because we're seeing, again, where you see children having insomnia, poor school performance, headaches, abdominal pain, severe fatigue. That again plays into your psyche. So those are things that perpetuate some of the mental issues that we're seeing within our children. And so it's not just about having, 10 days of what a lot of people want to liken to of just a cold. What comes behind that? Does your child develop long COVID? Does your child have issues with smelling or tasting? What does that do to my ability to want to eat when I can't taste the food as a child? What does that do to my appetite? And so all of those things are very vital to our children as they're growing and developing. I am fully developed as an adult. I'm probably okay not eating for a few days and losing a few pounds. But in my growing child, that is not okay. I want to make sure that they're getting the daily nutrients that they can get. And so understanding that there's so much more that comes behind just that, what we would declare as a URI kind of mild COVID type illness. There are things that can come behind that could severely affect your child, including MISC.
Thank you for that. So there's another great question from the comments. Should there be a public health campaign to get kids vaccinated before they go to summer camps, swimming pools, boarding camps, all of these things they're going to be doing over the summer? Should there be some sort of public health campaign to get parents, hey, before you start camp, get vaccinated?
So I think every local, state, county health department in the United States has really been pushing vaccines and trying to educate people around vaccines. There's vaccine centers. You ought to be able to get to a vaccine center within 10 miles of your home somewhere in the United States. And so I think we're out there saying get vaccinated, and trying to make sure that parents are aware of where they can get vaccinated. Our local pediatricians have come on board and brought in vaccines into their clinic. And some of them are even vaccinating the parents along with the children. They're saying, hey, if you're ready to get vaccinated, we'll vaccinate all who come, even though I'm a pediatrician. They're doing their part to make sure that we're protecting as many people as we can. So I think it's imperative upon parents to get good information. There's so much bad information out there on the internet and circulating around. To just surround yourself with good information. Go, if you've not seen your pediatrician in the last year or two, go into your pediatrician and have a conversation around routine vaccinations as well as COVID vaccines.
Dr. Molinex, could you reiterate the duration once the packet's open? Because I think there was a lot of, early on they were talking about the sub-zero, sub-freezing
Right.
temperature. It had to be kept at, and then it was only available once you opened it. It could only be used in a certain amount of time. Today, you kind of illustrated that time has been extended. So kind of reiterate that for our audience, that let them understand that they've got time, not too much time, but they've got more time to get vaccinated.
I appreciate that. Yeah. So the standard storage condition for long-term storage is still ultra low temp. So, and that's been extended up to 9 months now, which before it was only 3 months, then 6 months. Now that's been extended to 9 months. However, for the new formulations, particularly orange top, which is for adolescents, and for gray top, which would be the 12 and above, it can now be stored in a regular refrigerator for 10 weeks. For 10 weeks. So that's a significant expansion. Because before, for purple top, it was less than 4 weeks. And that was a major inhibitor. Now, I want people to understand. They say, well, why didn't you do this at the beginning? Well, people understand we had to get this vaccine out fast. And we had an emergency going on. And typically, the process of bringing a vaccine to market takes 5, 6, 7, 8 years. And part of that is the manufacturing of a acceptable product. Well, because of the pandemic, we didn't have that opportunity. So we had to get out quickly what we had to try to help save lives and et cetera. So we are now moving what would be a typical process to a more stable and easier use formulation. And that's what's occurring now. So you're going to see these changes. As you'll see with the maroon cap when it comes out, we'll see better storage and ease of use considerations.
So in layman's terms, what they were focusing on was safety and efficacy first, right? That
Yep.
was the two most important things. Is it safe for human consumption, and does it work? So and then they said, okay, let's put that out. And now they're saying, okay, now the refinement is going. We got safety, we got efficacy. Now let's see if we can make it better. And so that's what you're seeing now is a safe, effective product that's now being improved upon. So don't think that
Exactly.
just because they're going back to market, they're like, oh no, the first one didn't work. No, they worked perfectly. What's happening is that they're improving upon it so doctors can use it better, so pharmacists can use it better, so they can store it longer. You have more opportunity to come in, and there's not a lot of waste. Because what can happen previously was they break open that pack, people aren't getting those vaccines, then they got to throw it out once it hits that certain mark. Now they can hold it a little longer, so there's less waste. So just want to give people some understanding on that, but I don't want to confuse folks and think that that old vaccine wasn't as good as we're doing. No, it's the same. It just made it better. So,
Thank you.
right. Good question here. Now, that's what I mean. I'm the translator for layman folks. So, another good question. What resources are available to help those working with children identify when a child may need help from mental interventions? Are there any kind of resources that because I mean teachers are already under enough stress, right? They got masks, they got to go into a classroom full of some 25 to 30, sometimes even more children with different households and face that kind of stress every day of potential exposure. And now that, is it on the teacher? Is it on to identify this in that to the counselor? Is it on the parent? What resources are available? How do we identify those kids that might be experiencing some higher levels of anxiety and stress as a result? You know,
So I think it's imperative on all of us. I would encourage parents to go to aap.org. There's lots of resources there around mental health. I think our teachers and our school counselors are a huge part of our children's health. Sometimes they recognize things that we don't even see as parents at home because children will display different behaviors in different environments. And so our teachers and our school counselors play a vital role to that. And they've done an awesome job throughout this pandemic helping children when they're in need. And then also on top of that is your local pediatrician. Take your child in if they're not sleeping, if they're not eating, if their mood has changed, if they don't seem to want to do the activities that they used to do, if they seemed excessively fatigued, anything that has changed significantly in your child, don't just say, oh, they're becoming a teenager or, oh, they're going through a growth spurt, all those things that we tend to write off. I think in the midst of COVID and everything that they've been through in the last 2 years, now is not the time to write those things out. Now is the time to sit down, have a conversation, take them to their pediatrician. If you need to talk to the teacher and the school counselor, hey, what are you seeing in school? Do those things. Bring everybody in. We've got to be a community at this point and wrap ourselves around those children to make sure that they're receiving the resources they need in all areas.
So, if your child has showing a loss of appetite, a loss of interest in activities, if they're showing mood swings, right, particularly irritability or isolation, if they're starting to isolate, not reach out to their friends, if they are a big change in the classroom, if they went from kind of quiet child to now more gregarious, or the opposite, they were more vocal and now they become quiet. Any of those type of big swings, you can't just say, oh, well, they're going through something. Now, take it, get them evaluated. And then if the doctor says, and y'all work with the counselor, or the doctor says, oh, yeah, this is part of that going, then you can relax. But right now, it's really, we have to be hyper vigilant with regards to our overall childhood health. Because, yes, this is stressful. This is stressful on us as adults. So we don't know what our children are experiencing because, again, they don't have the full mental capacity to be able to process all of this information that's going on. They just know adults are fighting about COVID. You got to wear masks and not wear masks, and then in some cases, you got adults standing outside school screaming at them about putting the mask on and all this other stuff. And so it's been chaotic. What impact is that having on our children? So we have to be diligent about making sure that we're protecting the most vulnerable of our population, and that is definitely our children. So as we're wrapping up here, we're going to see if there's any more questions. I'm trying to see if there's any more questions from our very, very smart audience here that's been watching, and we would say thank you to both of you for bringing in Dr. Molinex, for really kind of helping us understand the improvements that we made on the vaccine and then where they can be applied, right? And what we're looking for. So just to recap, just recently as yesterday, thinking about having 65 plus getting that second booster, that fourth shot, because again, that is another most vulnerable group, and that's been impacted significantly by this virus, and so they've applied for that. There's also they're hoping to apply for emergency use authorization for 5 to 6 months to 4-year-old with regards to getting vaccinated. So they're working through that portion right now. But anyone from 5 to up can get vaccinated at some level. And so please work with your pediatricians. Pediatricians are, by the way, and I think people don't realize that. They just think that that 5, I think this 5 to 11, Dr. Brown, is that 5 to 11, they have to go to a pediatrician to get that vaccination, don't they? They can't just walk into Walgreens and get it.
No, there's a lot of community sites that are doing 5 to 11 vaccine.
Okay. So, but please consult with your child's pediatrician. Find out if they're immunocompromised because that puts them on a different schedule. And there's no dumb question in this whole situation. There are no dumb questions. Ask the question. Get the answer. Don't live in confusion. And don't let the internet be your own resource, right? Don't let, Google MD is okay. I get it. Google has gotten me through a lot of things. But I'm going to ask my doctor first. I'm going to make sure it's verified through reputable sources and not just, somebody's video on YouTube. So, sarcasm is second language to me, so I'm trying not to utilize it right now. But I just want to say thank you to both of you. This has been a wonderful and enlightening conversation. We're going to re-air this, so for those of you that are watching right now, if you have somebody that needs to watch this, as a parent that have children that are about to go on spring break, give them this program, share this program, tag them, and we will re-air it tomorrow at noon on BlackDoctor.org so you can watch it again and get this information out. We have to get information about the vaccines out. We have to get information to keep our children safe. Thank you again. And thank you everybody for joining us. Thank you all for great questions from the comments. A lot of people from your home state, Alabama, joined us. At least the folks that put there where they're watching from there. So shout out to Alabamians out here trying to keep their children safe. So with that, I have filibustered enough, and we are going to end this broadcast. Thank you, and we will see you next time here on